All right, let's get started. Okay, I'm very excited. I have the pleasure today of introducing Dr. Santhosh. So she is an associate professor in the pulmonary critical care medicine here at UCSF. She has served as the inaugural DOM Associate Chair for People Development and Mentorship and received her MD from Harvard. And then she completed her internal medicine residency, chief residency, and pulm crit care medicine fellowship here at UCSF. During her fellowship training, she completed a master's in education at Berkeley, and currently she attends in the medical ICU, the neuro ICU, and the hospital medicine teaching service, as well as the outpatient pulm clinic. She's also the founder and medical director of the post-ICU, post-COVID optimal clinic, and also is an APD for our internal medicine residency, focusing on curriculum, scheduling, and has published extensively in the medical education realm around issues of equity in medicine. Her primary scholarly interests are related to ICU, transitions of care, women in leadership, clinical reasoning, and subspecialty career choice. And nationally, she's one of our inaugural National Academy of Medicine Scholar in Diagnostic Excellence, and the chair-elect for the American Thoracic Society section on medical education. And most recently, she's been awarded the Gold-Headed Cane Endowed Education Chair in Internal Medicine. So we're so lucky to have her today. I still recall some of our mentorship meetings during residency as well. So without further ado, Dr. Santosh, I'll let you take it away.
Thanks so much, Dr. Partita, for that very kind introduction. And it's great to see so many familiar faces here. And I'll be on hospital medicine next week. I hope to consult you all just the right amount, not too much, not too little, right? So I'll share my screen now. And I've been asked by your division to talk about speaking skills. And this is a topic that I became passionate about because I think many of you who know me know that I love people, I love to chat, I love to listen, but I actually have a long-term hatred, fear of public speaking. And it took a lot of years of practice to actually feel more comfortable with it. And I wanted to share what I've learned in the hopes to help any of you who are experiencing that to get better at this skill, which is very teachable. I don't have any disclosures. Our goal is a fun, casual, engaging, interactive environment, even on Zoom. I will start on time and end on time, not to worry. This is going to be a step up, step back situation. We're going to be brave. It's confidential, and we're going to have a growth mindset. We're here to learn. Of course, I'm mindful of barriers of turning video on. I know many of you are kind of commuting between sites, but if you're able to, because speaking is very visual and we're going to practice, if you're able to turn on your video, that is great. Pets, partners, babies, endoscopy, suites in the background, all welcome. And we're all here to learn and have fun. So feel free to type in the chat or unmute. What words or emotions come to mind when you think about having to do public speaking?
There's always a little bit of dread that comes to mind
Dread.
too.
Dread is a very common word. Thank you for sharing. About 30% of Americans have a fear of public speaking. So you're not alone. Anxiety, concerned, worried. Time to sing your song. Tell your story. Thanks, Gloria. So I see mostly negative words, but some positive words. Depends if it's to pipeline excitement. Oh, I love it. I love it. So it kind of depends the context, a mixture of negative emotions, positive emotions. I love it. Thank you for participating and being brave. And then another question, again, ironic, because I'm here talking to you on Zoom. What challenges, advantages, disadvantages have you all experienced with public speaking in this Zoom or hybrid area? So same thing, type it into the chat or unmute. What challenges have you experienced or witnessed, or what advantages have you experienced or witnessed?
I find that eye contact is a big part of what motivates me to do well when I speak publicly. And so losing that in Zoom sort of takes away some of the je ne sais quoi that you can get it when you're really trying to motivate or send home a point.
Thank you so much, Molly, for sharing that. Is that you lose some of this feedback. Yes. So when people are saying lack of interaction or feedback from the audience, less interaction from the audience, lack of interaction. Yes. And You say a joke, you have no idea. Pros, Sarah points out, you can wear pajama pants. You are correct. Lots of love in the chat for that. I am wearing real pants, hard pants, as they say, not to fear.
You're
Hard to see folks.
clearly at work, but if you're at home, you don't have to
Yeah.
wear uncomfortable clothes.
Which is a pro, and hard to see folks' faces as you're speaking as well. So I think we've talked about some advantages, disadvantages in the hybrid or Zoom area. And remember, when you're a speaker, you'll be holding all of those. So let's talk about some strategies now. We're going to fly through these objectives. By the end of our 45 minutes here, you're going to learn how to apply some public speaking skills to your next presentation or opportunity. We'll have lots of chances to ask questions. We are going to increase your confidence in your public speaking abilities. And how are we going to do this? We are going to practice. So why is this important? I'll just go briefly through this. We're all here because we love to teach, right? We want to communicate our message, whether it's as consultants, to our patients. We want to affect behavioral change, either again amongst our trainees or our patients or our colleagues. We want to demonstrate our own expertise as consultants, whether you're speaking on rounds or you're speaking at a professional meeting, AGA or AASLD or whatever conference, DDW, all of your conferences. And when do we teach? All the time, right? A lot of you are very involved in the med school, in the residency, in the fellowship. Of course, at the patient bedside, we're teaching and speaking all the time, in your clinic precepting room, in the procedure suite, if you're on a committee, if you're at a local, regional, or national conference. We'll practice these skills and use these skills. And like it or not, you're going to be perceived or judged, even positively or negatively, with your public speaking skills. So it's worth it to get better at as a micro skill for us to practice at. And again, we teach during rounds, we teach during procedures under times of stress. We're all involved in meetings. Some of you might even do podcasts, and we'll touch on some principles of good slide design as well. The source of my content is largely from this great book called The Credibility Code, written by this actual public speaking coach named Kara Alter. She is a public speaking coach. She focuses on everyone from physicians, lawyers, executives, everyone in between. And I'm going to summarize her book here so you don't have to read it. But if you do want to read it, it's a great quick read. And she talks about these 6 pillars of public speaking that we'll dive into really briefly, each one: posture, gesture, voice, eye contact, derailer, and focus. And we'll return again and again to these pillars throughout our time today. First, I just wanted to acknowledge the context that often when I teach about public speaking skills, I have to put this glaring disclaimer up front, which is the words of our First Lady, Michelle Obama, saying, it's not always enough to lean in because that shit doesn't work all the time. And I think what the take home here is that we have societal forces, right? We have structural racism, sexism, bias that can impact how folks are perceived, unfortunately. And we have to do our best to still actively combat and advocate against those larger structural forces. And improving your own public speaking skills is a tool in your toolbox to sort of help you advance your goals, communicate your message, get what you want to get out of it. Does that make sense? All right, so I promised you we're going to practice, which is, again, always a bit tough on Zoom, but we still make it work. I've done this workshop on Zoom many times as well. So I'm going to ask you to actually take a second, turn off video and audio, and I'm going to time you for 45 seconds. And I want you to speak to the invisible Zoom screen for 45 seconds about your hometown, okay? Ready? If that's a topic that you don't need any expertise at, I'm not going to ask you to report back on the hemorrhoids grand rounds. That was right before me, though you're welcome to talk about that too. So in a few seconds, you're going to talk for 45 seconds to your invisible camera about your hometown. I'm going to do it too. I'll model it. Make sure to mute yourself. 1, 2, 3, go. All right, your 45 seconds are up. Hopefully not too hard. So when you were doing that activity, again, you were talking to your invisible Zoom self, you were alone, hopefully, or, not with a bunch of people. What are skills that you felt right away that, ooh, this is something that I have to work on? And for everyone, it might be difficult. Feel free to type in the chat and unmute. I want to get better at X. And it's okay if you say, my public speaking is perfect when talking about my hometown. Keeping points succinct. Yes. How do you get your message across within those 45 seconds while also honing in on your key point, your take-home point? Others? Decreasing filler sounds in words. Perfect. We will talk about that. Okay. So let's go through each of these very briefly. So posture pearls. This is an important one. When you're delivering a Zoom talk, more often than not, you will be sitting at your desk. But when you're delivering a real life IRL audience talk, we want you to have a good posture. And right now, whether you're sitting or standing, take a second to improve your posture. If you're able to stand up, you can join me in standing and stand tall with a strong spine, with your weight over both feet. Another point, you can sit back down now. A lot of times what we'll see on rounds or when people are giving talks, and again, I'm effectively going to ruin talks for the rest of your day, if not your next couple of months, as I point out these pearls, because you'll notice them in other speakers. A lot of people, when they're speaking, they tend to shift their weight from one foot to the other. You'll see that on rounds. You'll see that in talks at a podium or presentation. So try to keep your weight over both feet. Try to keep your head level. If your head is up, it has this impact where people feel like you're looking down on them. And if your head is down, you're just reading this paper on rounds, it has this impact that you don't really know what you're talking about. So try to keep your head level. And one way to do that is to point your nose at your listener. And again, for the Zoom audience, for this type of Zoom talk, play a little bit with your camera so that where your camera is, again, kind of at your head level, at your Zoom level. So it's more natural for you to have eye contact with your camera. And try to command the space around you, even again, if it's in person or on Zoom. I'll talk to you a little bit about that in gestures. Diana had mentioned derailers. What are derailers? Derailers or fillers are these very common words that often slip out when we're nervous, anxious, talking too fast. They are like, but, really, all of these type of words. And 98% of people you talk to will have fillers. And those 2% that don't probably had fillers and have been working on them. So working on fillers is a process. We will talk about a quick exercise to work on fillers. Oh, great question, Robert. Where do I find instructions on showing PowerPoint slides while speaking on Zoom from my computer from home? That's a really good question. I'll get to that in a second in slide design. Okay, Robert, I'll come back to your question. A next thing that's very common that you'll see in public speaking that is something to avoid is upward inflection. Upward inflection is when you end the sentence as if you're asking a question when your voice is going up at the end. Naturally, if you're asking a question, what's the weather today? It should go up at the end. But if you're having a sentence, the patient was prepped and draped for surgery, it should actually end down. And upward inflection is not a gendered thing. It's not a regional thing. Once you pay attention, you'll notice it in people of all genders. It's very common. And the way that if you have a problem with upward inflection, if you struggle with upward inflection, you're not alone. It's very common. The best way to do that is actually to practice by reading something aloud. When you read a book aloud, whether it's a kid's book or the New England Journal, that will help you naturally end your sentence lower than when you started. Or you can imagine your words being propped up on a little ball, and you want the ball to drop at the end of a sentence. At the end of a question, of course, it's natural that you'll end at the end up. So, what's the weather like today? What is this patient here for? But a sentence should actually end at the end at a lower octave. Extraneous movements. This is a common one. Sometimes you'll go to a presentation, a lecture, and you'll see that people's hands are all over the place and it's distracting. The other opposite of that is robot arms, where people do not move at all. Their arms are glued to their side. We want to avoid both of those, and we'll talk about that in gesture. And the last one that's really common is self-commenting. I see this a lot in our trainees, our fellows, our residents, as well as people who are, minoritized in medicine, whether that's women in medicine, folks who are underrepresented in medicine, where people say, I'm just a fellow. I don't know much about hemorrhoids, GI bleeds. I'm just a med student. I'm not an expert in sarcoidosis, but blah, 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 blah. So avoid that self-commenting. You're speaking, you have the microphone. It's your time to be the expert, and don't discount your expertise right as soon as you walk in the door. We're not going to do this activity, but this is right now, but this is an activity that I encourage you to do at home or at work with a partner, a roommate, a kid. Kids can be brutal. And what it is if fillers are an area that you want to work on, every time that you have a filler, ask the other person, whether it's your partner, mom, roommate, kid, to gently raise their hand. So every time you say a like, an an you have them gently raise their hand. And that is the way you get better at fillers, just by practice. When I do this activity and workshop in person, I have people break up and do this. And often people start off, because they're very aware of it, not using filler words, they start off with 0 fillers, 0 flags. And as you speak more quickly, or there's times of stress, you see that hand going up and up again. So practice this activity if fillers is something that you want to improve on. Let's talk about gestures. The first tip is to avoid masking. And masking does not mean your trusty N95 mask. It's really about having a facial monotone, no expressions on your face when you're presenting. That's what masking is. So you want your face, your eyes, all to have some expressiveness, especially again, over Zoom, where I can't really reach out to you or touch you or say hello or see you. You want to engage your gestures up front. Again, it's distracting if people's arms are all over the place here. You want to exchange your gestures up front. There's this imaginary gesture box that goes about from your mid shoulders to your waist. And when people speak with their hands naturally in that gesture box, it's more natural than if they're going way out here, or robot arms. Another tip is to reach out to listeners. You're inviting people to join you. That's another tip. And again, I used to be robot arms myself. Every time I gave a talk, I would just have my arms firmly planted towards my side. But if you stay in this imaginary gesture box that you can all make right in front of you right now, it's a natural place for your hands to go during your talk. Eye contact. Again, this is a tough one over Zoom. So I suggest repositioning your camera so that you have natural eye contact. I have been to division chief interviews where I've had an entire division chief interview where the chief candidate was looking over here because they hadn't set up their Zoom. And it was very distracting to do an interview for somebody who wanted a job when they were looking over here the entire time because they had difficulties with their share screen or their Zoom. So Robert, to your question, it's really important to actually troubleshoot your Zoom setup in advance of a talk or a lecture, log on a few minutes before to make sure that share screen all works. So a natural eye contact is about 3 to 5 seconds per person. If I'm staring at one person the entire time, it can get very uncomfortable. Similarly, if my eye contact is all over the place, it looks like I'm distracted, I'm not focused. The most common thing I see at presentations, at lectures, either locally or nationally, is people have great eye contact with the slides behind them. And they're giving their whole talk to their slides behind them. That's no good. Don't let that be you. The audience doesn't want to see your butt. No offense. They want to see your face. They want to see your eyes. So know your content, know your slides. Try to engage everyone. If you're looking across a room, look to the left side of the audience, the right side of the audience, in front of you, back of the room. Keep your eyes up. Again, when you're presenting on rounds and someone is just reading their paper like this, it's really hard to concentrate what they're saying. That makes you want to check your phone too. And be interactive with your eye contact as well. Vocal pearls. This is another common pitfall that I see. A voice vocal register of 1 is barely a whisper. You can practice and say it with me. 1. A 2 is very soft. 2. A 3 is a normal conversational pace. 3, you're talking to your friend, you're talking to your office mate. 4 is actually your optimal public speaking voice. It is louder than your normal voice. It is louder than if I'm talking to my office mate. It should feel a bit loud in your ears. The most common pitfall that I see is that people speak at a 3 or a 2 when they should be speaking at a 4 when you're giving a talk. And if you have a mask on in the hospital and 95 or surgical mask, you have to talk a lot more loudly than you think. That mask muffles your speech. So it might sound like you're yelling in your ears. That's normal, right? That's the insulation of our skull bones. But you have to speak a lot more loudly when you have a mask to be heard. Again, whether that's in the procedure suite, the ICU, in a lecture hall. Articulation is making sure each word can be understood, not having one giant run-on sentence. Relaxed pacing. This is making sure you're not too fast, not too slow, where the audience checks out. A happy medium is good. And expressiveness in your voice. Again, avoid that dreaded monotone when someone is presenting all their data and you cannot understand. And resonances, as a pulmonologist, I can't help it, speaking from your diaphragm rather than your vocal cords. Teaching on rounds, you're going to use all of these same principles. Teaching under stress, teaching procedures, you're going to use these principles. Meetings, again, podcasts, and we'll say a few words on slide design. So a quick word on rounds, right? You all do a lot of teaching on rounds. You're consultants, you're talking to primary teams, you're in clinic. A lot of public speaking is also setting the right tone, being inclusive right up front, listening. When you want to ask a trainee something, make sure that your clarifying questions or your fellows are succinct and clarifying. Invite and acknowledge input from all your team members, both verbal and nonverbal. That's going to be really important. One tip from Daniel Kahneman's book, Thinking Fast and Slow, that's a Nobel Prize winner, is use short words to talk about hard things. And when you're in an emergency situation, don't basically mess around with flowery speech. Use short words to talk about hard things. So if you say, I'm not sure exactly what's going on here. I'm a little bit worried about the O2 sat. Should we maybe call for help, like anesthesia or something? Instead, if you're worried this is a high stakes situation, you should say, this patient is desatting. We need to call a code. So short words to talk about hard things. Under times of stress, best to not beat around the bush. We're all very West Coast UCSF polite, but short words when talking about hard things is really important, especially in emergencies in that code or pericode situation. And another thing to know is kind of the clarity of our messaging. Of course, Dr. Fauci was an amazing public servant and hero, especially, but not limited to the early days of the pandemic. And he had to think about how to effectively convey a simple message about social distancing to the American people really early on. And he said, hunker down more than you have been. And that's just a simple couple of words, a simple, memorable phrase that he used to convey to the public what he wanted to do. He didn't say, social distancing technically refers to 6 feet of people apart, blah, 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 right? He kind of kept it simple. He distilled his message simply. So this is really important when you're talking about public-facing communications. And again, a lot of you do research where you get a paper published and you'll be asked for a quote about that paper, for a press release or the Chronicle. And so you'll want to think about how is your science going to be perceived? How do you communicate that science to the lay public? That's really important. Science communication and public health communication are yet another facet of our jobs and another part of our professional duties, honestly. So if you have data, if it's a data-rich talk, grand rounds, talking about your paper to a presentation, humanize that data, whatever you have, tell a story, make it relevant to your audience, and mess around with it, debrief it, rework it. You may need to give it a couple of tries to see what is the right messaging that lands. To Robert's question early on, you're futzing around with the slides and the share screen and it's not working out really well. Tech failure can and will occur, especially in high stakes situations. I gave a grand rounds a couple of months ago, and there was some internet bandwidth issue where basically the audience could see no slides of mine, but they could hear me and see me for whatever reason. The video totally failed. And so I just had to deliver my content with a frozen screen, essentially, talking about my slides without being able to see them, neither the audience nor I. And so the point is, you should know your content extremely well as you know the lyrics to this song, Happy Birthday. You should know your talk and your content really well so that if there's technical failure, if there's no presenter view on your slides, which often fails, depends on the podium or the situation you're going to. If you can't figure out if your home computer versus your work computer, the share screen is a little funky, the Zoom setup is a little funky, come early, set up early, experiment with your share screens, get help, think about how to ask for help and come early to troubleshoot all those technical things. And most importantly, know your content well in case of tech failure, which can and will happen. If you do podcasts for teaching, a great podcast is by Dr. Ashley McMullen and Dr. Kimberly Manning here, the Human Doctor. Podcast is even more challenging than a Zoom lecture, right? You have no video input and you're not there in person. It's pure audio. It's like the radio. So try to speak clearly, make sure to pause between sentences, hit that period, use emotion and inflection in your voice. And recording yourself is challenging. It's hard. But remember, in things like podcasts, they can actually edit out the ums and uhs and like. So you can focus on the message that you're trying to say because they will do a lot of editing to delete those pauses. Last point about slides is that the slides really don't give the talk. We've all been in lectures where the person is just reading off the slides. If you are giving a talk where one could just read off the slides, there's no reason for you to be there, right? So you are the talk, you drive the story, you convey the message. So make your slides be a helpful adjunct to your point and not just be a verbal script of everything you're trying to say. So be authentic, draw from your experiences, and know that you're the messenger, you're the talk, and you're driving the story. And often a simple picture slide with just a key image or a couple of keywords goes a long way. You don't need a lot of words on a slide. Of course, if you're presenting the latest trials where you need to show the figures, that's a different thing. But again, less is more often to distill home your key message. Another tip about slides is to zoom out of your slides, put it in the slide deck view to make sure that your slides have a mixture of words, pictures, citations, that there's a little bit of variety in your slides, that they're all not the same, like a couple of bullets of text, a picture, a couple of bullets of text, a picture, because again, the audience will zone out. So try to have some diversity in your slides. If you want to find more about public speaking resources, the American Medical Association, the AMA, actually has a lot of good resources. They have a toolkit on how to public speak, presentation best practices, slide best practices, media relations, social media, all of that. And Presentation Zen is another great website that I would recommend to talk about, again, slide deck design. If you're kind of a font nerd, go for it, things like that. Last but not least, let's turn to the elevator pitch. And this will have some time to practice. So elevator pitch. Anybody know who this is? This reference is quickly becoming dated.
Diego Montoya.
Yeah, Inigo Montoya. And so The Princess Bride is the movie, and he goes, "Hello, I am Inigo Montoya. You killed my father. Prepare to die." Perhaps the most concise elevator pitch in history. And so what we're going to do in our last interactive activity, where I will put you in breakout rooms if I'm able to, is, and if not, you'll again do it to yourself, which is the dreaded elevator pitch. So that is, you are meeting a leader or a visionary in your field, either locally or nationally. You're in the hallway and you run into Talmadge or Catherine Lucy or your division chief or a research collaborator, mentor, superstar in your field who's a visiting professor. And oftentimes the elevator pitch does not come organically to people, so I'll have you write it out first. So again, first imagine an upcoming professional opportunity when you use this elevator pitch. Perhaps you're interviewing for a new position, a leadership role, a job. You have your professional society, DDW, AGA, ASLD coming up. You have a research collaboration meeting. You're going up for promotion, something like that. And someone's going to say, oh, hey, Diana, I haven't seen you in a while. What have you been up to recently? Right? That happens all the time. Classic UCSF and classic society meeting. So first you're going to write your pitch and then deliver it. And I'm going to ask for brave volunteers. And I know many of you, so if you don't volunteer, I will call on people. And so fear not. So the elevator pitch, it starts with, I'll break it down for you. It starts a little bit with, who am I, right? So Catherine Lucy may be like, oh yeah, you look familiar. And you have to remind, she doesn't remember if she met you as a med student or a resident or a fellow or an attending or what. So first, a refresher. Who am I? Hey, I'm Lekshmi Santhosh. I'm an associate professor of pulmonary critical care medicine at UCSF. I've been here since residency and so excited to see you again. What's the point of connection? What do you have in common with that person, or what do you hope to have in common with that person? So something like, it's so good to see you again, Dean Lucy. I just really wanted your input on how the university could best respond to the current events that are happening. Then you say your ask, right? Would you mind blah, blah, blah? Would you mind sending me your latest paper on this? Would you mind keeping me in mind for future opportunities? Blah, 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 whatever the ask is for that person. And you're going to say your value add too. So you're going to say, I have this deep expertise in medical education, and I would love to help you with X. I have this expertise in health disparities research. I would love to help you with X. My research project is very well aligned with yours. I would love to help you with X. And a follow-up plan. I'll email your administrative assistant to get a meeting on the books. I would love to connect after the AGA meeting to discuss this further. So again, a lot of times this elevator pitch doesn't come naturally to folks. Again, none of us went into sales, right? We went into medicine because we want to help people. So this is highly unnatural and weird for us. And it comes up all the time. So it's good for us to practice. So first, I'm going to give you 3 minutes to actually write out your little spiel. And then I don't think I have breakout room capabilities here. So I'm going to give you 3 minutes to write your spiel. Then I'm going to come on mute and ask you to deliver your 1-minute spiel to your silent camera self. And then I'm going to ask for volunteers. Okay. So 3 minutes, I'll leave the slide up so you can look at how to write out your pitch to your imaginary division chief, chair, chancellor, dean, research super mentor, and take 3 minutes and write it out. Go. Time flies when you're having fun, so your 3 minutes to write out your pitch is up. Now let's take 60 seconds for everyone to practice your elevator pitch silently to your own camera. And after that, I will ask for brave volunteers. So let's take 1 minute to practice your pitches to your camera. All right, our 60 seconds is up. I will ask for a brave volunteer or two to deliver your elevator pitch to me or to the group. Again, safe space, brave space. We're all here to learn and grow. Pretend that you're seeing your super mentor or chancellor or chair to deliver your elevator pitch, and they say, "Hey, how's it going?" So who wants to volunteer?
Hi, I can go.
Thank you.
No problem. What was the name of the person?
It's whoever you will deliver this pitch to, whoever in your mind sees you and is like, "Oh my gosh, how are you doing? What are you doing here? What's up?" So a super mentor or your chair or your division chief, program director, whoever in
That's
your
good.
world.
All right. Oh, hey, Dr. Eggs. It's so good to see you. It's been a while. I don't remember who you are. Oh, well, I'm Asase Obo. We met when I was in residency at Hopkins, finished that, and I'm now a first-year GI fellow at UCSF. It's so good to see you. And I know you've been doing a lot of work within the DEI space, which is very tenuous given the current climate. And I would love to meet with you to just talk about the work that you are doing and how I can get involved. I currently have a nonprofit that really focuses on pipeline work to get more students of color into medicine, specifically as physicians. And was also president of the SNMA, and I would love to have a hand in the work that you're doing. So let me know what's the best way to follow up with you.
Round of applause for Asasi. That was wonderful and so hard. You took that deep breath at the end, right? It's not easy. I commend you for putting yourself out there. That was amazing and that was beautiful. You said who you were. You were hearkening back to a prior connection. You gave your ask. You said, "Hey, this is my expertise that I'm bringing in this space. I would love to collaborate with you. Let's follow up." So well done. Amazing. And it gets easier each time you do it. Wow. Let's take one more volunteer. That was amazing.
I can go. I'm a pediatric GI fellow, but happy to
Welcome. That's so
participate.
great. Please.
Hi, I'm Ala Abdelghani. I'm a third year pediatric GI fellow. We actually met in the fellows meeting last year. It was so good to see you again. I'll be starting my hepatology, transplant hepatology year in July, and I am hopeful that we can meet to talk about the pediatric hepatology position you have in your department. So it's great to see you again, and I would love to set up a meeting so we can talk more about the position you have. Thank you.
Congrats, Ala. That was amazing. Again, very real world, right? You're going to be applying for jobs very soon. And so you're going to be doing this all the time. And you succinctly said who you are, how you've met in the past, what your ask is, what you're hoping for to talk about a position. and making a plan for follow-up. So bravo to our brave volunteers. Thank you for volunteering. And again, it should feel hard. That's normal. And it gets easier with practice. Okay. So each one of you, I'm going to ask you to type in the chat. What is your 1 minute commitment to yourself to improve your public speaking skills as a gastroenterologist? Where are you going to next practice these skills? So what are you going to work on? And it's so much harder to say, I'm going to improve my public speaking. Pick one tiny micro skill to type in the chat to say, I want to work on fillers. I want to work on my volume, speaking at a 4 when I'm on rounds with a mask. I'm going to use short words in hard situations. I'm going to focus on my filler words. I'm going to focus on my content. So type in the chat everyone's 1 minute commitment to yourself. Filler words, filler words. A lot of people said fillers. Short words in hard situations, fillers. So you all have seen, right? Asasi, Api, and Ala have all written fillers. Next time you see each other, play that flag game with each other, right? You've self-identified something that you want help with, so help each other out. Reducing vocal fry as a filler sound. Oh, that's a good one, Molly. Totally. So we all can improve our public speaking. This is a commitment to yourself. Thank you for listening, taking the time out of your busy schedule as fellows and faculty to listen. My brief take-home points is practice makes perfect. Practice your micro skills each time. Next time you're getting a Starbucks, if you're asking a question at a meeting or conference, presenting on rounds, pick one skill at a time, right? Rome was not built in a day. So it's going to be hard to transform your public speaking skills. And remember those 6 pillars of the credibility code: posture, gesture, eye contact, vocal range, your fillers, avoiding that, and your 5 steps of the elevator pitch. And I always end early to leave lots of time for questions. And that's another public speaking tip, is start on time and end early to leave time for questions. So thank you for listening. Again, I know you're all very busy and I appreciate you all. Feel free to email me, come find me. My office is on 10th floor at Parnassus. Email me, find me on social media, find me in my office, and I'm happy to take any questions that you all have. Thank you for listening.
Thank you, Lekshmi.